Hello everyone, I'm Dr. Arundhatee Khare. This is in continuation of my previous video where I spoke about the thyroid disorders in children, and we had covered the aspect of thyroid congenital hypothyroidism. In today's communication, I'd like to give you some information about thyroid conditions which are acquired through the childhood. So they have not been present at birth, but which happen during the course of the child's growing up years and right up to adolescence when they are entering their teenage and beyond. These conditions can involve the thyroid gland in 2-3 ways. In one condition, the thyroid gland's functioning can be less and cause hypothyroidism. In more rare conditions, the functioning of the gland can be in excess. And the other class of disorders where the thyroid gland can be involved can be in even more uncommon conditions of thyroid cancers, which are uncommon but still prevalent in children. I will like to focus on the first part because that is far more prevalent, and it is acquired hypothyroidism. Children as they are growing up can develop low functioning of the thyroid gland. This occurs more commonly because of a condition called as autoimmune thyroid disease, where a child's own immune system works against the thyroid gland. Autoimmune thyroiditis or Hashimoto's thyroiditis is pretty common in the population, and it is more common in females, and it causes a decrease in the function of the thyroid gland. Typically, as we know, thyroid gland is extremely important for the brain development up to 3 to 5 years especially, but even beyond that and through the entire course of the child's life, thyroid hormone is very important for the linear growth, for the length of the child's. So when a child suffers from low functioning of the thyroid gland, their height stops growing pretty much, and it is one of the most important symptoms of thyroid gland failure is a child who is not growing in height. It can also result in delay of puberty or the sexual changes. Sometimes these children will come with a swelling in the place of the thyroid gland. It is called as a goiter. They can come with anemia, they can come with constipation, which is hard to treat, and they can come with other manifestations. But the most important thing that is very important in childhood is linear growth, and in the absence of thyroid gland functioning, it is the child will remain short. These disorders need to be picked up definitely, and the best part about being able to pick up a thyroid disorder in childhood is that it is extremely amenable to treatment, that we can give oral medication. The thyroid medicine is in the form of a tablet. It is to be given every day, daily, in the right amount, and it is easy to give, it is cheap and very, very effective. The important thing to remember with thyroid disorders is that treatment has to be very regular. The follow-up with the doctor needs to be very stringent, and the tests need to be done at the right time for the doctor to be able to decide the right amount of thyroid medicine that needs to be given for best response. So compliance with treatment, monitoring and regular treatment is very important, and this is what I wanted to say regarding hypothyroidism. The other conditions where the functioning of the gland is very excessive, and conditions like there are nodules on the thyroid gland or thyroid cancer, these need to be seen by a specialist and evaluated very meticulously by them. So right now I think we'll stay with the hypothyroid conditions, particularly which is the autoimmune thyroid disease in childhood, which is the most common cause of low functioning thyroid condition in childhood.